And we're back on the record at 118. Here begins DVD number 2.
In 2015, on average, in that year, about how many hours a week did you work in your various professional duties?
那在2015年，就是平均，你每个星期，做你为你这个职业的这个职责需要工作多长时间？大约
？Easily to like 50 hours, 50个小时，一周嘛
？About
每天吗
？Hours per week? Do you ask them per day or per week?
Per week.
每周。
Yeah, that's about
Yeah, that's about it.
50小时这样。
50 hours a week.
Since coming to the United States, have you taken any formal instruction in English?
那你在来美国之后，你有没有受到过任何这个正式的英语的这个教育的培训？
没有正式，但是我为了不断的提高我的英语 spoken 的能力，我专门请教了像在维吉尼亚，even 在迈阿密，我都和英语系的这个教授这个来寻求指导，怎么进一步把英语提高到比较完美的程度。
Not formally, but in order to improve my English, especially spoken English, in both University of Miami and Virginia, I spoke with the professor in their English department to seek advice on how to improve my English.
And what advice did they give you?
那他们都给你什么样的建议了？
就是要不断的交流，不断的这个，就像我的 daily life， 那就是最好的学习方式。
Can keep continuous communication, and the best way to study English is through everyday life
and work.
When you write grant applications in the United States, are they all in English?
你在美国写基金的申请的时候，是不是都是用英语的？
是。
Yes.
Since coming to the University of Miami in 2001, have you taken any leaves of absence?
那你在2001年来到迈阿密大学以后，有没有中间有离职的这个情况？
没有。
No.
Have you taken any vacations?
有没有休假？
有的。
Yes.
Do you take them every year, every 2 years?
你是每一年呢，还是每2年一次呢？休假？
基本上每一年有长有短，根据我的这个繁忙的工作计划，根据我的自己的 schedule。
Generally once a year, sometimes longer, sometimes shorter, depending on my work schedule.
And when you take your annual vacations, how long are they for?
那你每年就是休年假的时候，是多长时间？
一般都不超过1周。
normally shorter than a week.
Are your vacations in conjunction with any professional duties or obligations, such as a convention?
那你的这些休假有没有包括一些就是职业的这些个职责，比方说参加会议？
基本没有会议，我就一般都是会议。
No, for conference I will go for conference especially.
Especially, you said?
For conference, it was
主要就是
for the conference.
Conference.
It's different for the vacation.
not for vacation.
Did you say not for the vacation?
It's not for the vacation,
Okay,
right?
that's what I heard. That's what I heard.
Yes, conference. I know.
Conference is conference and vacation is
Right.
vacation,
I
doctor?
don't like, go for conference, then, take some vacation together.
Oh, I see. In 2015, on average, how many patients did you see a day?
那在2015年的时候，平均你每天看多少个病人？
2015年，我呢，先从这一点，60%时间我是 patient care。
First of all, in 2015, 60% of my time is dedicated for patient care.
30%研究指导。
And 30% was for research direction.
10%作为 management as a director of research for department.
And 10% is management or administrative
然后指导
works as
住院
a
医生和
director
青年
of the
医生的这个职业发展。
and I was responsible to direct the young researchers and the doctors for their professional development.
How many patients did you see on average a day in 2015?
那就是2015年的时候，你每天平均要看多少名病人
15到20个。
？15 to 20.
不是每天，
But not every day.
因为我的临床时间，我记一下，像我星期一 Monday 15年，那是我的 research day。像星期二可能是我的手术 day、OR day， 星期三是我的 clinical day， 看病人。 星期四是我的 management day， 星期五是我的 patient care day。 大概
So,
15年
for example, in
Yeah.
2015, during each week, on Monday it was my research day, and
No patient at all,
and,
no clinical duty.
and Tuesday, it was for the operating. My OR day is for operations, and Thursday for clinic. When
Wednesday.
Wednesday was for clinic, when I saw the patients, and Thursday was management day, and Friday was for patient care.
Is patient care different from clinic?
那你这个就是这个 patient care 这个和 clinic 这两天是一样的吗？
这一天比较 special， 因为我也 run 一个 clinic 和儿科遗传大夫在儿科系 special for 复杂的耳聋病例，这 Friday。
But that day, the Friday is
clinic basic。
is different because I also run a clinic with the doctors from the pediatrics for those children with genetic deafness on that day. So it was different.
Basically, it's a clinical day, office day.
Would you say that both Wednesdays and Fridays are clinical days?
那你是说星期三、星期五都是临床？
对，depend on 有时星期五可能有 OR， 这个非常 depend on
Yeah, it depends.
case 或 OR available.
Sometimes I have to do the
After.
OR works on Friday. Depends on the work schedule.
In 2015, did your days, on the days that you saw patients, did your days start with the patients?
那你这个就是2015年，你就是看病人的那一天，你是那一天一开始就看病人对吧
对，从早上
？That's correct. From the morning,
8点还是8点半
like 8 or 8:30.
？8:30 I think.
Until about what time?
那一直到几点
一般是 noon， depend on
？Noon, usually noon.
And on those days, you would see an average of 15 to 20 patients, is that
那
right?
在那2天，你是大概平均要看15到20个病人，对吗？
是的。
That's correct.
Do you determine how many patients you see a day back in 2015?
那你就是在2015年那会儿是你决定每天要看多少病人，对吗？
门诊我的这个2个主要门诊，一个是星期三的这个门诊呢，是 depend on 还是整个医院的规定，比如根据病人和病例的复杂程度，是新病人还是复杂病例，所以呢，每个病人从15分钟到30分钟不等。一般呢，都是由我们的 schedule 的 office 在决定，我也有时候会决定。
So for Wednesday, the number of patients, the patients was determined based on the different situation of the patients, whether it was new or whether it was a complicated case, and the scheduling they will be scheduled for 15 through or 20 minutes. The scheduling was done by the schedule office of the hospital. Sometimes I can participate in the scheduling.
As a general rule, did you participate in the scheduling of your clinical days?
那你就说正常一般的情况下，你是不是参与你的就是看临床的这些天的那个病人的时间安排？
一般没有。
Normally no.
You mentioned that your patient hours end around noon, is that right?
你说你看病人的时间是在中午结束，对吗？
比如说按 schedule 是这样，但是真实的事件，因为大家知道这个病人，我们都是以病人的这个病情满意程度，然后我作为医生不会说不同的病人，那就在那个时间，如果需要更多，我总是会达到病人满意的程度。所以呢，一般很多时候中午都完不了，都可以要有延长或者有点，但是这是以病人的这个满意程度和病情需要。
That was what the scheduling said, but in reality, the time was depending on the situation of the patient. As you know, we have to take care of the patients to satisfy their medical situations, and most of the time it will be extended to later time.
Did you have total discretion over how much over the schedule that you would go?
那你就是说你安排多少病人，就是这个是你能够完全自己决定的吗？
从我的 practice 来说是这样的，大家的这个从来没有，就是说由于 schedule 的原因来牺牲病人的 care， 病人的管理。
It was like that from my point of view. We never had any argument, or we never did anything to sacrifice the benefit of the patients because of the scheduling.
Let's talk about Wednesdays. After patients, what would you do in the afternoon?
那么我们想一下，星期三你看完了病人以后，那下午你做什么？
一般2015 now，下午是我的 academic time，有时候会 schedule meeting，然后那一天呢会有我们有系里的 every third week like a faculty meeting。我呢一般由于我的 management， 我会有很多 meeting schedule 到星期三下午。
In 2015, generally, I do in the afternoon, Wednesday afternoon. It was my academic time. I went to different meetings, and every 3 weeks we had a department faculty meetings, and also because of my management duty, I also schedule some meetings on that day, on that time.
但是我很多时候在我自己星期三下午，要是我早上的病人需要为病人着想，比如说要有些什么 procedure 早上不能做，或者他的 insurance 公司没有 authorize， 我 always 帮助他们能够下午能够得到处理。我不管我的 time 有多紧，这个patient 的这个 management 还是作为我的第一考虑。
However, in many situations, for example, when I couldn't finish or complete some treatment to my patients, or the patient's insurance company was not authorized at the time, so I would schedule them in the afternoon to help the patients to finish their treatment, to meet the requirement for the patient treatment on that time.
Were you ever late for a meeting on Wednesday afternoons?
那你星期三下午有没有开会迟到过
Normally no，
？Normally，
但我不会，一般我 schedule meeting 都会在2点、3点以后。
Normally no. The meeting I usually scheduled after 2 or 3 o'clock in the afternoon.
When you began at the University of Miami in 2001, what was your compensation?
No. You don't have to answer that question. Or tennis motion for protective order.
那这个 2001年你在迈阿密大学开始工作以后，你的工资是多少？你的律师说不要回答，他会跟那个法庭讲。
So I'm directing you not to answer that question.
律师告诉你不要回答这个问题。
好的。
Does the number of patients that you see affect your compensation at the University of Miami in 2015?
那在2015年的时候，你所看的病人的人数是不是会影响到你的工资收入？
不会。
No。
Does the obtaining of grants affect your compensation at the University of Miami
那你就是获
at any
得，
time?
就是在你在任何时间你获得基金的这个获得，对于基金的获得是不是会影响你在迈阿密大学的收入
没有，
？No。
不是。是我的 staff， 主要是我的工作人员可以，因为基金主要是用来
It was
做工作人员。
for my staff. The grant the grant were normally for compensation to my staff.
My question is, if you were successful in obtaining grants for your staff, do you have an understanding that that affects your compensation in any way at the University of Miami?
What you
Maybe.
object, you've mischaracterized his testimony, but if you understand it, you can go ahead and answer it.
就是说，我的意思是说，如果你能够成功的获得这个基金，然后呢，给你的这些个工作人员付工资的话，那么这个对于你在迈阿密大学的工资收入会不会有影响？那么你的律师说呢，他反对，但是你可以回答。
我觉得没有，不会。
I don't think so.
Some of your patients that you see have insurance in 2015, correct?
那你2015年看的这些病人中间，其中有些病人是有保险的，对吧？
大多数都有
Yes，
在
most of
我的这个星期三的 clinic 基本上都是有，除了很多他从那个international 国际病人或者私人，他愿意自己付的。
Normally, for my Wednesday clinic days, most of the patients had insurance, except for those who are international, or some people would like to do the self-pay.
Is it your understanding that by the time a patient is scheduled, their insurance status has already been taken care of by the scheduling office?
那你是不是理解或者知道，就是在你的病人被安排看病的这个时间的时候，他们的这个保险这方面的这个情况已经被这个就是负责安排预约的这个部门已经都查过了。
对他的 office visit 是这样，不会otherwise 的话，他可能不会在我的 Wednesday clinic， 但是对很多那个 procedure， 像这个 even 像 move 这个叮咛，和做一些检查，在做之前我们必须要有 insurance 的同意，这种事情，这是我们具体为什么要这样做，那是医院的问题。
Yes, for most of the patients, when they get into the schedule, in the schedule they already been take care of for their insurance. But however, for some procedures like removal of cerumen, we have to confirm about their insurance status before do these kind of procedures.
What is your involvement in that procedure whereby the scheduling office interacts with the insurer for coverage?
Can we just rephrase it, because he's used procedure in one sense, meaning a medical procedure, and now we've used it, and I don't want him confused with the medical. Do you understand? So you've asked what is his role in the procedure.
What is your role in the scheduling office's procedures in interacting with the insurer to resolve any issues in the patient's insurance coverage?
你就是说你在那个跟那个负责安排预约的这个部门，你是如何，就是说你在那个在他们关于这个病人的这个保险，就跟那个病人的这个保险，交涉这种保险状况的时候，你是如何参与的？
我参与的就是 medical reason 的部分，其他都是因为我们是大学医院一个 group， 都是有一个 team 在做。我完全是谁需要做什么，完全以病人的需要和出发。
The only part I participated in that procedure was providing the medical reason. Other than that, because this is a university hospital, and we had a special team to take care of all of those processes.
Understood. Do you oversee the scheduling office?
那你有没有？你是不是负责这个监管监督这个负责这个预约的这个部门呢？
没有，我们这
No.
Is the scheduling office centralized? Does it schedule other doctors as well?
那这个就是安排预约的这个部门，它是一个中心的预约部门呢？就是说，换句话说，它是不是也被别的医生做预约？
应该是，但具体我不是，应该我们2015年 University Miami 已经好像 centralize 这种 schedule。
It should be, but I'm because in 2015, I believe the University of Miami already had this centralized scheduling department.
As far as you know, you don't have a dedicated scheduling office devoted to your clinical practice. Is that right?
那也就是说，你自己没有一个就是专门的这个负责预约的这么一个部门来专门为你来做这些个病人的预约，对吗？
我们这个在 hospital level 有人，这是 centralized office。department level 我们也有 office 来监管每个医生的 scheduling， 应该有。
We had a centralized department for scheduling at the hospital level, but in each department we also have people who was responsible to overseeing each doctor's schedule.
系里应该有。
Yeah, in the department there should be a
像
people.
我有我的 OR scheduling，
So for example, I have my
我的 clinical secretary。
I have my clinical secretary to handle my OR scheduling.
OR is OR scheduling. Clinic.
Yeah, but that is for OR.
Operating room? Yes?
Yeah, schedule my cases.
Scheduling your operations or all your cases?
Right.
No, the question is, your secretary, did she schedule just operations? Your OR?
That's a department that have 3 people for all the surgeons, OR scheduling, including mine.
Okay. What about your clinical? Did you have a dedicated staff that scheduled just your clinical?
And I believe that person also scheduled, for example, for year group. For year group, I'm ear doctor,
Ear doctor.
otology.
Let's do this in interpretation.
就是I believe there's people who's doing the scheduling for the year groups.
The otolaryngology department?
Yeah,
Okay.
ear otology, ear.
Otology.
Yeah, otology, oto.
Do you at any point make the determination of who to see or not see? You, Dr. Liu, make the determination at any point of who to see or not see based on ability to pay?
就是你本人有没有就是在任何时间做过这种决定，就是看哪个病人不看哪个病人，就是基于他们是不是能够付费，在这个基础上决定看哪个病人不看哪个病人？
没有
，no，
从来没有。
never。
对
That's handled by the scheduling department, is
这
that
块
correct?
这部分是由他们那些做预约的部门来决定，对吧？
Statement of his
主要是由预约部门，而且有很多有时间，譬如有的失联病人，他们来了，有付费的困难，我都会，因为病人已经有，而且他可能需要我的 specialty， 我会为病人着想，就是在我的权限范围内，还是看他们，给他减免所有的，至少我的 part 的费用。这种我经常有的病人会这样做的，但是绝对不会以某个病人不能付费而拒绝病人的研究 ，never。
Yes, they were handled by the scheduling department. However, for me, for myself, sometimes when the patient, the self-pay patient, come to my office and when they had difficulties in paying, I sometimes will try. Within my scope of capacity, I would try to help them.
从来没拒绝过病人。
And maybe waive some of the charges for my charges, and I never reject a patient because they couldn't pay.
How much discretion or oversight do you have into the scheduling office's screening of patients based on ability to pay?
那么就是在这个预约，就是安排病人预约的这个部门，他们就是根据这个病人的这个付费能力来筛选病人的这部分工作中，你参与了多少
？Zero， 从来没有参与过，
No.
他们也没来咨询我，
No.
除非我自己有的病人 call 到我，因为被其他 doctor 介绍来，我加进去的，就是根据我的expertise，但从来没有我自己 personal 没有参与这个医院的 scheduling，没有。
No, zero. They never. I never participate in that kind of part of work, and they never ask me for my opinion. So the only time is that when some patient was referred by other doctors, I may contact that scheduling department for them.
Yeah, to add on, that's to my understanding. 我的理解，这是我跟 scheduling 的联系。
Yeah, that's my only communication with the scheduling department to add the patients on their schedule.
And these patients contact you directly that get added on?
那这些加进去的病人是直接和你联系
对，
吗？
有的是病人直接联系，知道我的这个专家，我的擅长方面和其他我的在比如全国知道我的专业领域的医生，
Yeah.
或者也包括有朋友。
Sometimes sometimes they were the patients who know my reputation nationwide, and sometimes they were my friends who knows me.
Has since becoming licensed in 2008, has all your medical records been electronic?
那2008年你拿到这个行医执照以后，就是全部的行医执照之后，那你是不是所有的病历都是电子化的病历？
不是，因为像我们的 Wednesday Clinic 大概在 CRB 是6年前开始的，5年前，以前在另外一个 building 的时候，还基本上是纸记录。
No, not really, because for Wednesday clinic, our the medical record was electronized, was like 5 years ago, and before that, when we were in an older building, the medical record was still handwritten.
Did you get that?
In the older building?
In the older
Yeah,
building.
other. 大概
So the medical records were converted to an electronic form in 2013?
那就是说，在2013年，你的那个病历被转换成了电子病历，对吗？
有的是，应该是，但是我因为在2015以前，2008，我负责3个医院的医疗 ，Jackson Memorial Hospital, University of Miami, and the VA.
It could be, but because from 2008 through 2015, I was in charge of the medical part of the medical management for 3 hospitals, the Jackson Memorial, University of Miami, and the VA.
They were all different?
Yeah, they are different. Yeah, VA is always electronic.
Okay.
Since 我在做住院医生的时候。
Since yeah, the VA was electronic when I started my residency.
Jackson Clinic is combine both electronic and paper.
Yeah, the Jackson has combined
对
the mixed.
那个时候呢 ，University Miami 我们 affiliate 在那里，这个临床主要是 medical record， 就是写下来的。
And the University of Miami at that time was primarily handwritten, the paper
For my
paper
department.
record for my ENT department.
And you're talking about the years 2008 to 2015?
你说的是2008年到2015年这个
应该
期间。
是2008到可能2013。Not quite sure exactly.
It should be 2008 through 2013. I'm not quite sure.
By 2016, all of your medical records at the University of Miami were electronic?
那在2016年的时候，你是不是全部的病历已经都变成电子化的了？
是的。
Yes.
Were you given any formal training in how to use electronic medical records?
那你有没有就是对于就是如何使用这个电子病历系统进行过正规的培训 ？Yes.
Tell us about it.
能不能跟我讲一下？
这 training 医院都有很完善的制度，对每个医生，然后这个怎么用，因为怎么这个做记录，然后所有的那种HIPAA regulation 就是 privacy， 就是如果需要详细情况的话，这个 university 都有完整的 training 制度。
The hospital has a pretty comprehensive training programs for each doctors.
我们都要通过 training 过后才能用。
As how to use the system and how to be HIPAA compliant, and we had to pass the training in order to use this system.
Can you tell me what your process is in inputting your notes into the electronic medical records during or after you see a patient during clinic in 2015?
那就是你能不能告诉我啊，你在看病人中间，或者是看完病人之后，你是如何就是把你的那个笔记记入到这个病历中？在2015年的那个时间。
好的，我的那个星期三门诊啊，在这个2015年是在CRB office fifth floor， 就是我现在的主要门诊的 office。
Okay. So my clinic in 2015. For my Wednesday clinic was at the CRB office, the fifth floor.
这是我已经近6年形成的，从 CRB clinic 我们的这个耳鼻喉科的耳科门诊在这里开始，我的从记录病人、看病人的程序是这样的。
We had like established the procedures for 6 years ever since I started at the CRE oncology clinic.
我的星期三的 clinic 原则上是 hearing loss clinic, special for patient with 这个耳朵的 complaint, 耳朵毛病的 ear complaint.
In principle, my Wednesday clinic was a hear loss clinic, especially for patient with ear problem.
病人首先有当天和我工作的护士 call in.
The patient was first called in by the nurse who worked with me at the time.
I'm going to interrupt you. We're not talking about Ms. Fertil right now.
No, I'm not talking about her.
Oh, good.
We're-
Okay,
No, no.
because you said the
It's a
patient. Thank you.
他的问题是问我怎么来做我的。
Sorry.
So your question was about how I do my routine daily work.
Yeah. Now, whatever nurse call in my patient, 那我们有很清楚的什么护士在做，但最重要的当然就是问病人的这个一般的病史，然后进行这个重要体征的检测，由护士完成。
So the nurse will call in the patient, and first the nurse will finish the general questions regarding to the history of the disease, and also some important vital data
like 像心率、温度、血压。
like heart rate and blood pressure and temperature.
然后，比如说这些都正常，一般护士都要，就把，然后我们有 clear sign 哪些完成了，有没有问题，然后一般我是两个 corridor， 3个 room 在 prepare， 我就进去，然后如果说有什么问题 ，nurse 会告诉我哪方面值得注意。
So normally we have in the clinic we had 2 corridors and 3 rooms for the patient.
Oh my God.
And when the nurse finish her part of questioning, she will make the record, and if everything was okay, and I would go and see the patient, and if there's something abnormal, the nurse will talk to me and tell me about this.
And then when do you input your notes into the electronic medical records during this process?
那您就是在这个整个这个看病，在这个过程中，你什么时候开始向这个电子病历这个记录中输入你的笔记？
Most of the cases, I will do and finish same time I see patient, did my necessary procedure, and record them whatever they important or I thought necessary in my conversation with the patient most of the time.
So it is your general practice to input the electronic medical records contemporaneously or immediately after you see a patient?
那么就是说，你这个在看病人的同时，或者是看完病人以后，马上把这个信息就输入到这个电子病历里面，这个是你正常的工作的程序，对吧
80%的病例是这样，有时候，特别是有的可能讨论，我会，后面一点，但是像这些 simple 的 procedure， 我一般都是做过后和病人交谈，然后我就完成。
I would say 80% of the cases was like that. Sometimes when some of the information that involves that requires discussions, and I would do that later. But other than that, I did the input at the same time or immediate after I talk to the patient and do the procedure.
So in about 80% of the time, you would input data into the electronic medical records and then move on to your next patient?
那就是说，在有80%的情况下，你是把这个数据输入到这个电子病历系统以后，然后你就去看下一个病人了，对吧？
是这样的。
That's right.
Do you personally input the data into the electronic medical records?
你是本人自己把那个数据输入到这个电子病历里面，对吗？
是的。
Yes.
No dictation?
就是没有这个指导别人。
这里没有了，我们这个 clinical 的这个就是都是 input.
No, in our clinic, no.
Even
just do the input.
Even procedure.
Even in procedure, we don't do that.
It's clinic.
In other words, it's part of procedure that you personally type in the data into the electronic medical records?
就是说，就是说在那个正常情况下，在那个做这些 procedure 的时候，你自己输入这个
是的
数据。That's right.
是的。
Does anybody review your notes in the electronic medical records after you input them?
那你在这个数据输入到你的电子病历里面以后，有没有人来这个审阅或者是来看你这个记录？
应该没有。
There shouldn't be.
Okay. What information do you input into your notes into the electronic medical records?
那你像你的这个电子病历系统中输入的一般都是什么样的信息啊？
这就是一个综合，我们有很standard， 有很标准的way，比如作为 ear nose throat 病人，有非常 standard way， 哪些是应该记录，哪些不用记录，也不是说所有我跟病人讨论的东西都会记录，还是就说有很 standard way。
As a ENT clinic, there is a standard way of requirement on what kind of information we need to record and what. Not everything I discuss with the patient will be recorded.
What are the standards?
那这个是什么样的标准呢？
那就是病人来的原因、主诉然后讨论病人的长短，就是病人的现病史、过去史，这个然后我的治疗方案和建议。
So it's the reason of the visit, the complaint of the patient, the current situation and the history of the patient, and also the treatment and advice of the doctors. Those were the information I should put in.
Okay. And where did you learn that this is the information that you should put into the electronic medical records?
那你是从什么地方知道的？就是这些信息是需要输入到这个电子病历里面的。
那从我在这个美国进行住院医生的训练的第一天开始，在不断的就开始就是这种 standard 的。
That was from the training I got since I became the residency in American hospital, and I've been given this kind of a training continuously on how to make the medical record.
So you're training in what the standards of what information to input into electronic medical records began with your residency training
2003
2003?
所以你就是哪些需要记入到电子病历中的信息，是你在从2003年开始你住院医的训练的时候就开始进行这方面的训练了。
应该是这样。
That it should be like that, yes.
Were you given any training on any negative consequences, if any, that could or could not occur if you did not adhere to the standards that you just described in inputting data into the electronic medical records?
那你有没有受到过？就在你的受到的这培训中，有没有告诉过你，就是如果说您刚才提到的那些需要做记录的那些个信息没有记录到这个病例中去的情况下，会产生什么样的负面的后果？
有的知道，
Yes, I
And
know.
what were they?
那都有包括什么？
包括你病人的这个来就诊的原因，你所进行的治疗选择，和病人探讨治疗的选择和咱们医生给他的建议。虽然最后 decision 是病人来决定，还有就是有的可能这个不管作为一个自己的医疗团队，这个对病人重要的其他相关的医疗问题，也应该进行的讨论的这种记录。
Including the patient's, the reasons of the patient's visit and the options for the treatment and also the doctor's advice and opinion. Of course, the final decision was on the patient, and also some discussions between the medical teams regarding to the treatment. Those were all supposed to be recorded.
My question to you, sir, is were you given any, let me ask you this, were you given any advice or training on what kind of negative repercussions or consequences, if any, could occur if you did not adhere to the standards you have stated about inputting data into the electronic medical records?
我刚才问您的问题是，你有没有受到过任何培训，或者是有没有人告诉过你，如果你没有遵守就是您刚才所提到的那些个需要向这个病历中所输入的信息的这些标准，如果说发生这种情况的话，会产生什么样的负面的后果？
受到过。
Yes.
And what was that advice or training that you received about potential negative repercussions, if any?
那您受到过什么样的训练，或者是别人给你的这个建议，就是关于这种情况下会产生什么样负面后果的问题？
对，因为当然在我们看病理当中，不可能记录我和病人所有的交谈的记录，但是对重要的记录，建议，特别是病人寻求来看你的这个疾病，你要有很详细的记录，当然病人是一个整体，对其他相关的问题，如果你医生注意到了，也应该进行这方面的讨论和记录。
Yes. So we need to have a very detailed record for why the patient came and what kind of a treatment we have suggested, and all the other discussions related to the situation of the patient.
如说，但重要的部分，要是没有，更重要的是，或者没有给病人以适当的咨询，那就是这个会造成这个严重后果。
And there will be very severe negative consequences if some important information was missing, or we didn't give the correct suggestions to the about the patient's treatment.
What severe consequences?
那都会有些什么样的后果？
譬如像什么药物或者有的 procedure 的 这个 complication side effect， 或者病人的有些他自身的 condition， 虽然不在我的专业范围内，比如说我没有给病人咨询到的话，这些都可以导致严重的后果。
So, for example, the side effect of the medications and complications of some certain procedures, and also some special conditions of the patient, even though it's out of my specialty. And if I did not have a clear record, and that will cause very severe consequences to the patient.
我是完全知道这个，而且不断的，这是咱们在训练当中最重要的任务之一。
I fully understand about this, and it was one of the most important part of all the trainings I received.
In my practice, even I always follow that.
And I always follow that in my practice.
Follow what?
你说是
Follow
遵循什么
regulation, standard,
the regulations and
standard care.
The regulations and standards of inputting data into the electronic medical records?
So it's
是
not just that, or the
Wait, let's go through that.
就是说你指的是就是遵循在电子病历上输入信息的这些个标准和法规，对吗？
和法规和病人的管理和照顾。
And the standard for patient management and the care.
Can you explain to me what your definition is of a medical emergency?
那你能不能跟我解释一下，你对于这个医疗的紧急情况，是如何定义的？
Overbroad form.
医疗紧急情况就是这个病人不管什么原因，由于 medical reason need immediately care， 紧急的医学治疗。
The medical emergency means that the patient, for whatever reason, need urgent, immediate care, immediate medical care.
Would you notate in the electronic medical records if you saw a patient and he or she was in a state of medical emergency?
那
Incomplete hypothetical.
当你遇到一个病人，他有这个医学上的紧急状况的时候，你是不是会把这个记录到这个电子病历中？
这种情况，一般是会的，但是很多像来我们 ENT 的这种病人啊，要么是有 for example airway emergency， 那个的话，不管病人是怎么状态，我们马上要采取很多行动啊。由于病人其他的原因，像血压高，或者病人 feel not good， low sugar， 这个我们和病人的交流是第一位的，因为这是我的 routine 门诊，而不是这个ER 门诊。
Yeah, generally, I generally I would. However, for our ENT patients, most of the time what we see is their so-called airway emergency. The patient with airway emergency required us to take the actions immediately. For other situations such as hypertension, low blood pressure, or some patients who just don't feel comfortable for whatever reason, we may not, because we are just a routine clinic, not an emergency room.
I think you can look over this here a little bit, because you see if I'm seeing anything.
Can you read back my question?
Here.
Okay, yes.
Would you notate in the electronic medical records if you saw a patient and he or she was in a state of medical emergency?
My question is it your practice to put in the medical records if you saw a patient in a state of medical emergency? Is that something you would put into the medical records?
那么我的
Form, incomplete hypothetical.
我的问题就是在你这个行医的这个过程中，如果你见到了一个病人，他是有这种医疗上的紧急情况的时候，你会不会把这个情况输入到你的电子病历中去？
这要根据病人的情况。如果说病人因为这个 measurement 是一个方面，病人的 perform 要是有很严重的 medical emergency， 我第一要首先和病人交流，看看病人，因为来我的病人，一般来说来我的这个星期三门诊的都是非常 stable 的病人，都是很。但是我要一定要马上看病人，而不是说马上就 put 到 medical record。
Usually it was I mean for medical emergency the measurement is one thing, and we also have to look at the performance or appearance of the patient. So communication will be the first thing I should do. So for like my Wednesday clinic, most of the patients were in pretty stable condition. So if I see something, some measurement that indicate some emergency, the first thing I do will talk to the patient and make the evaluation.
With all due respect, I don't think you're answering my question. Okay.
他说我那个什么很尊敬的跟说这句话，我觉得你没有回答我的问题。
Denied. Doctor.
Yes.
Okay. I'm not. In your professional expertise.
就是医生就是在你的这个专业的领域中。
When you see a patient.
就当你遇到一个病人。
In a state of medical emergency.
这个病人呢，他是在这个一个紧急医疗的状况下。
Is it your practice?
那么就说作为你的这个行医的职责。
To notate that fact.
是不是需要把这个事实记录？
In the electronic medical records.
记录到这个电子病历中。
Wait just a second.
应该
I object. It's an incomplete hypothetical.
Yes.
是的。
Have you always done that?
那你是不是一直就是这么做的？
不是总是这样，但是
Not always.
Tell us about the times when you have not done that.
那你跟我讲一下，就是你不这样做的时候是什么情况？
不这样做的时候，有时这个做了一般 routine 的把病人处理好过后，有时候是说啊，要么我这个比如下颌，我觉得应该加进去的或者完善的情况，然后再做一些补充，都是可能的。
So for most of the time, for this situation, is after I finish the routine treatment, I would add those data back to supplement my record.
但这种不是很少。
But it was not very often.
What was not very often?
你说什么不常有？
就是说，一般我都是在和病人交流过程当中做完这个 procedure 和病人已经满意过后，接受我的建议过后，多数时候我的 medical record 都已经完成了，但是有时候可能有什么原因，或者下一个病人需要看这个 schedule， 可能就 move 到下一个病人。
It means that most of the time I would complete my medical record input during and or immediately after my interaction with the patient and the procedures. And but sometimes because of the scheduling, I would move to the next patient and add the information back later.
And during those times, you might forget to input all of your information?
那这种情况下，你会不会就是忘记把这个所有的信息都输入进去呢？
这是可能的。
That's possible.
是。
Since you became licensed in 2008, about 10 years, during your clinical days, how many cases of medical emergencies do you recollect seeing?
那在你2008年拿到了你的行医执照以后，就这10年，大概有10年了，然后呢，你这个每周的看这个门诊，你能够记住大概有多少次是这样的情况？
那情况是需要 emergency care?
Do you mean the
还是
situation when there's some emergency medical emergency situation, or the time for the
forgot
for the record?
I'm not talking about records right now, doctor. Since you've become licensed in 2008, how many times in your clinical practice did you see a patient who was in a state of medical emergency at that time?
就是说我们不是说这个记录，而是说就是在你2008年开始正式行医以后，你多少次你见过这个病人是处在这个紧急的这个状态下？
at least 50个。
At least
different
50 for different situations
different hospital.
in different hospitals.
Could you read the answer back for me, please?
At least 50 for different situations in different hospitals.
Thank you.
Were you the doctor that was responsible for inputting the data into the medical records for all 50 of these cases?
那
Do you remember? Do you know?
那这50个就是你说这50次这种情况下，你是不是都是负责输入电子病历的这个医生呢？
应该有的是，有的不是，因为像有的就是一个 teamwork， 我们譬如要像现在的 clinic CRB 要有 emergency 的话，我们 immediately 的，如果说病人同意了，就交给这个 management 的 team， 我们的 nurse， 让他们得到 urgent care。
Sometimes I would, but not always, because sometimes it involves teamwork for the treatment. For example, like in CRB, if the patient agree for emergency treatment, it will he or she will be taken over by the management team
to
to the emergency room.
In those situations, how was it determined which doctor would be responsible for what data into the medical records?
那在这种情况下，如何决定是哪个医生负责把这个信息输入到这个电子病历中间去？
如果这个病人同意去了1、2，那当然是在门诊的时候，就是他精致的医生和护士团队和 management 的团队。
So if the patient agree to go to the ER, it will be the physician who performed the
give a suggestion.
yes who saw the patient at the time in the clinic, and also the nurse and the management team who are responsible.
When a patient is in a state of medical emergency, what is your protocol in how to treat that patient? Medical protocol.
Objection, incomplete hypothetical.
那你那个就是说，当一个病人他是处在一个紧急的状态下，医学紧急状态下，那么你自己的话是有什么样的步骤来处理这样的病人？
一般，因为像我的门诊，首先第一个我知道medical emergency 是从我的这个护士定知道的这些 vital sign 或者，但最重要的是从我和病人的交流和我的检查。
First of all, generally I learned about the patient has the emergency situation from the notice from the nurse, the vital signs the nurse recorded, but most importantly, it was from my communications and interactions with the patient.
And then what do you do next?
那接下来你做什么？
当然是立即讨论 emergency 的 issue， 在进行我专科任何检查之前。
So I would have these discussions with the patients regarding to this emergency condition before I start any my specialty procedure.
然后给出我的建议。
And I would give my suggestions to the patient.
When a patient is in a state of medical emergency, what would be your suggestion?
那如果一个病人他是处在紧急状态下，那你会提供什么样的建议呢？
Wait, objective form of complete hypothetical. You hadn't answered.
他说你可以回答，这是一个假设性的问题，但是你可以回答。
这种情况下就有不同的状况scenario。
So for this kind of a situation, it depends on the different scenario.
好，比如说我们 ENT clinic 能够处理的 emergency， 我会告诉病人立即展开。
So if the emergency is something our ENT clinic can handle, I would tell the patients we're gonna perform that kind of a treatment immediately.
如果病人的状态是由于其他原因有 emergency 的 urgent 的指标，那我会给病人这个建议需要处理 emergency 状态 first， 然后把这个常规的 medical visit 放到后面。
If the patient has some emergencies that is outside the ENT department or specialties, I would give the patient suggestions to do the emergency treatment before we start our routine procedures.
What do you mean by emergency treatment?
说这个就这种紧急的这种处理治疗是什么意思啊？
那当然，因为 emergency 有不同的情况，比如说那个这个病人如说有 any 这个 medical crisis， 像病人他 complain， 比如说有心痛，chest pain， 那就有可能是心绞痛，或者猛向 vital sign 很高，血压有可能发生这个其他的 medical emergency， 那都需要 immediate 治疗。那我们会叫病人要先有 emergency 的治疗，再进行专科处理。
For example, that depends on the different situations. For example, if the patient has like a chest pains or have some signs of a heart attack, or he has other abnormal vital signs like high blood pressures, I would talk to the patients and suggest them to do the emergency treatment before I start the routine ENT procedure.
What does that mean, begin the emergency treatment?
那你就是开始这个紧急治疗处理，这个是什么样的处理？是在什么地方进行？
那当然就是我们的 routine 是要immediately 建议他去 emergency room， 有 medical emergency room 和 surgical emergency room, even beyond our ENT specialty.
Our routine is to suggest the patients to go to the emergency room. We had a medical emergency room and also the surgical emergency room.
You mean at UHealth?
Yes. And affiliate, and also our affiliate county hospital, Jackson Memorial Hospital, with.
And his.
Can you repeat the answer?
Go ahead. Go through the interpreter, please.
And also the affiliated county hospital, like Jackson Memorial,
Just across the street,
which is
from my clinic.
Across the street from my clinic.
Now, I'm going to ask you to speak. Now, let me ask you this. Do you remember Miss Bertha Fertil?
我问你一下，你认不认识？还记不记得这个 Bertha Fertil 女
Yes，
士。
是的，
Yes，
非常清楚。
You communicated with her in English, right?
你是和她用英语交流的，对吧
Of course，
？Of course。
Is it your, did you tell her to go to the emergency room?
你有没有告诉她去急诊室
Yes，
？Yes。
Can you talk to me like you talked to her? How did you tell her that?
你能不能就是告诉我，就像你跟她讲话那样，你是怎么样告诉她去那个急诊室的？
Yeah，yes，
Who's the interpreter?
No, no. You have talked to me like you talked to Ms. Fertil.
Before that,
Did you talk to her in Chinese?
No.
Then talk to me like you talked to her.
Okay,
Thank you.
before I walk into room, I remember she was my second or third case that morning. Yeah.
No, I'm asking you
Well,
what I'm
just let
asking
him answer
you.
the question.
Let me,
It's
I
non-responsive.
agree.
No,
Okay.
you don't know it's not responsive because he hasn't finished.
Yeah,
So let him answer.
Well, I want what he's, let me tell you, Mr. McCoy, I want him to go through the translator. But all I want to hear from him in English is what he said to Ms.
I understand
Fertil.
that, what she's trying to do, and you cut him off because you
他就
decided
说
it
让
wasn't
你把
responsive
当
when he
时
hadn't
你
finished
跟
his
那病
answer.
人说
I'm
的话
saying let him
重复
Oh,
一
now
遍。
you're going to
Okay.
let him speak. Okay,
Well,
you know
no, you
what?
just
Go ahead.
asked him.
I grab my chart. This is my routine. Quickly look, but for her, before I grab a chart, my nurse that day already notified me that patient got a very high blood pressure. I grab that, lock the door, go in. You want to me shake a hand, say, you know, I'm Dr. Liu. Oh, she introduced herself. Oh, I'm Mr. Fertil from New York. So I said, oh, the first time come to me, they say yes. I sit down, and why I so remember her, because for that month, my son was just accepted to Columbia, to New York. Everybody from New York, I like to chat. Even my resident that year, we received some candidate from New York. Then I shake a hand and sit down, and she say, oh, I'm from New York, and also I came down for see my family vacation. Very pleasant, talkable, black lady with a nice, holiday, dress. I remember. Then we talk a little bit. I asked, oh, New York is, yeah, my son is going there, and end of a month we are going there for blah blah blah, and then sit down, open my chart. I say, Mr. Fertil, before we start, you got a very high blood pressure and can cause a serious consequence. Before anything, tell me, anything you need or anything you don't feel any discomfort. He said, no, I'm come down, I will see my family and have a good vacation here. And then I say, do you know you got this high blood pressure? I say, yes, I know. I already told my primary doctor already know that. I say, oh yeah. Then I say, are you comfortable for me to look at your ear pain or pressure? He said, yes, because I float like a day before or something like that. I got my right ear is some fullness pain, and then I say, okay, are you sure? Then I first, before I do anything, I say, for your kind of blood pressure, we strongly suggest you go to emergency room here to right down get any blood pressure medication. If you don't have, he said, no, I already know this. He didn't give me how long, and in the meantime, because I noticed my nurse's loads too, because my nurse also notified me. Oh, she said she always got that, and she doesn't want to. Even this is our procedure. Even like that blood pressure high, my nurse management team will strongly ethical or encouraging this kind of a patient go to ER cross the street. But let's say she told me, oh, no, I feel great. I'm looking forward. Then, okay, I start to I say, if you don't really want to go, but immediately you need whatever, talk to your internist or primary doctor. If this is new to show to you, she didn't give me any more information than but I told her verbally, this kind, is very high. It's like 200 over 110. We measured twice. I remember. I asked my nurse to, is it that true or it is. So then I start my procedure first. She came
You've
with
answered the question.
No, he's not finished.
You asked him what he said.
No,
to
I'm
her.
interested. Tell me,
Yeah.
doctor.
Well, wait, just
Go
a
on.
second, stop. She asked you what you talked to her about. If you want to
Yeah.
ask about the procedure, you can
And
go
then
ahead.
what happened?
Then I say, are you sure you don't go to alone? She says, I'm very fine, didn't have any numbness, headache. The only thing is after flight to Miami, whether or not the weather too humid, I got some pressure and a little bit of pain. Okay. I say, okay, if like that case, I will probably quickly do exam to find whether or not your ear pain linked to anything else or just something with, for example, fly, temperature change. You
Fly?
got
Like a buzz?
No.
Oh,
flying, air, pressure. So he said, yes, go ahead. I can't wait. That's my real memory. Present lady, very talkable, and also he mentioned to me by that I work at VA up New York. Then we chat a little bit because by that time I just off VA. Since 2008, I cover VA twice a month. I just off with it. So then we start. I say, okay, let me start with the ear. When I look at the ear, there are wax both sides to block my view for tympanic membrane. Now I say, okay, I'm going to remove that. So I remove that. Everything looks fine. No infection, no erythema, just a little bit of retract, which is caused by negative pressure, most likely from flight. So then I say that, and then also, for kind of cases, we are going to also examine the nose. I say I'm going to use a flexible camera, take a good look. You're inside the nose and the back of your nose. He said, go ahead. I'm okay. I asked him, did you have this before? I remember. He said no. I said okay, no pain, but not very comfortable. And nurse get the preparation, everything do very quick and smooth manner. And after that, we talk about that and conclude my exam. He leave, as far as I know, without any complaint or anything uncomfortable.
We talk.
Okay, well, wait 1 second. You're scowling. Did you get all that?
I'm trying to.
I know,
It
did you
just,
do you
it just
feel-
doesn't. Just doesn't sound like, everybody else's English. That's why I scowl because I'm.
You're struggling.
Yeah.
Would you read back the answer for me?
Everything.
Yes, please. Are you shaking your head? Do you think you got it? That's what I'm trying to find out.
Whatever I don't have, when I do the editing, I try to get from audio.
Okay, I get that. I'm just trying to figure out, you look like you're struggling, and I'm trying to figure out whether you think you got most of it or whether we got to go to the video to get it.
It says fly like a buzz. No, flying. No, air pressure. She said yes, go ahead.
Go back to
Get
earlier than that, please. To the first time she asked you to tell us what she told them.
And then what happened? And then I said, are you sure you don't go through? And she said, I'm very fine. You don't have any numbness, headaches. The only thing is
I'm
after
sorry, but I
flight."
want to go earlier than that. The first start of that narrative for a long answer.
Okay, let's see. I go out with my charts. This is my routine. Quickly, I look, but But before I grabbed the chart, my nurse, that they notified me that the patient got high blood pressure. I looked at her. I shook her hand. I said, you know, I'm Dr. Liu. She introduced herself. I'm from New York. So I said, oh, the first time you come to me? She said, yes. I sit down. And why I remember is for that. I remember that because my son just got accepted to Columbia in New York, and everybody from New York. I looked at the chart. Even my resident that year, we received some candidates from New York. Then I shake her hand. I sit down. I came down for my family vacation. Very pleasant, talkative black lady. We talked about, I said, New York. Yeah, my son is going there. At the end of the month, we are going there. And then I sit down, I open my chart. I say, Mrs. Fertil, before I start, you got very high blood pressure. This can cause serious consequences before anything. Tell me if you need anything, or if you feel any discomfort. She said no. I come down. I come down for my family, and I have a good vacation here. And I said, do you know you got this high blood pressure? She said, yes. I know. I already told my primary doctor. I said, oh yeah. Then I said, are you comfortable for me to look at your ear pin or pressure? She said yes. Because I flew the day before or something, I got right ear pain. And then I said, okay, are you sure? Then I first, before I do anything, I say, for your blood pressure, we strongly suggest that you go to the emergency room here to get blood pressure medication. Blood pressure medication. If you don't, she said, no, I already know this. He didn't give me. I looked at my nurse's notes too, because my nurse also notified. She said she always got that and she doesn't want. Even this is all the procedure. I got blood pressure high. My nurse management attachments. Patient to go. Okay,
Is that enough?
My
Or
nurse
do you
might-
want?
No, I just want, I'm trying to see if we're able to get it or not get it. That's what I'm listening to, so.
And are you satisfied, or do you still
I
want to go?
just
I
finished
mean,
it,
it
you're
is what
almost
it
done.
is.
Well, I know, and hopefully we can compare it to the audience.
For this kind of patient, to go to the ER across the street. But she told me, no, I feel great.
All right, I'm looking for
All
it.
right. Why do you? I believe the gentleman who's manning the camera would like a lunch break. I'm okay with breaking for maybe 30 minutes and reconvening.
Well, I gotta be out of here at 4:30 because I've got a 5:30, so I'll let you, you got an hour and a half, however you want to spend it.
Or I'm going to have to take another day. Is that going to be an
No, I
issue?
get that. So I'm just saying.
I appreciate that because,
Yeah.
you know, some lawyers will be very,
No, I got
but,
it.
you know, by the way, we're off the record, right?
We're on
I
the
want to
video.
say your
We are?
instincts in getting this guy over here was good
What?
because I usually,
This-
we
you thought
were
this
not
was-
told
Do you want
to get a
to go off
translator.
video?
No, we're off the record.
No,
yeah.
I
We'll go
know.
off the video.
Oh, sure, we'll
Stand
go off
by,
the
please.
video.
We're off the video. I get that.
I don't need either.
Here marks the end of
Lunch is
videotape
overrated.
number
I
2.
eat.
We're going
I get
off the
hungry.
record
Okay.
at 2:58.
You know what my breakfast is? Cigarette.